I'm going to tell you a secret, and I hope I don't get cancelled for saying this. But there's a chemical in what you're consuming that Big Pharma and the powers that be do not want you to know about. This chemical, dihydrogen monoxide, also known as DHMO, is corrosive. It can cause severe burns, and it's been found in the tumors of terminal cancer patients. But what's more worrying still is that all of you are consuming it daily. But dihydrogen monoxide goes by another name that I know you're more familiar with: water. Dihydrogen monoxide is water. How easy was it for me to manipulate information and scare or worry you about a molecule that we rely on for our existence? I'm Dr. Sooj, an NHS GP and emergency doctor, and I've been creating content on social media for the last 18 months. I've been working to improve access to evidence-based health information by creating compelling and digestible health videos. In 2021, in the United Kingdom, there were over 2 billion views just for health-related videos. Globally that year, there were over 110 billion views for health videos, and that was just on YouTube. Social media has democratized information sharing, making it a powerful tool for health education. It has the ability to create communities by bringing people together, and this is particularly important for those who are isolated from support networks and those who have chronic health conditions. It also provides the ability to connect and communicate with a global audience, and it can impact users far more successfully than traditional web pages. It can also inform and empower individuals about their own health. But social media has become a breeding ground for misinformation, with some influencers advocating some truly ridiculous things. Have you ever heard of a coffee enema? This is where you pour coffee into your back passage as a way to fight cancer and remove toxins. In reality, you'll just increase your risk of infections and perforating your bowel, and you'll probably burn your bum with it. There's an A-list actress and so-called well-being guru with no medical background who has promoted vaginal steaming to cleanse your uterus. She also sells a jade stone that has been carved into the shape of an egg that you can insert into your vagina. This is meant to, apparently, balance your hormones and release female energy. But what you may not know about the jade stone is that it is a porous rock. This means that bacteria can seep into it and stay there, even if it's been cleaned. This can increase your risk of infections, and it's best not to think about the damage it can cause the vaginal walls if it has a rough edge, or worse still, a crack. Did you know that false medical information is 70% more likely to be retweeted on Twitter, now known as X, compared with accurate information? How often has an article popped up on your Instagram or Facebook feeds that is clickbait? And you know it's clickbait, but you still click on it, skim read the article to get to the juicy part, and then feel disappointed at the anticlimax. Or even a video on your TikTok feed, and even though you haven't watched the whole video, you start reading the comments or share the video. How many times has the algorithm shown you how to do this one thing every day to get a six-pack? Or shown you how to make this home remedy a natural drink that will cleanse your kidneys or detox your liver? Health misinformation often evokes strong emotional reactions. It demonstrates sensationalism. It's alarming. And it activates the same dopamine-controlled reward pathways that make you feel good after exercising or after sex. This encourages sharing and commenting and leads the algorithms to boost visibility, regardless of the accuracy of the content. From a young age, we're taught to search for information online and click on the top result with the most views, without really considering the source and the motives. It can be really hard to know who to believe. For example, we would typically assume that the President of the United States is a credible source of information. I think you know where this is going. But Donald Trump suggesting that we need to think about injecting bleach? That doesn't sound like a very good idea, does it? Being able to distinguish between accurate health information and misleading medical advice is essential. Through my work on social media, I have been improving health literacy for the public with millions of views each month. By writing scripts, avoiding medical jargon, and simplifying complicated concepts, I've improved my own clarity of thought, and this has made me a better doctor. But what's better than that is that I'm playing the misinformation gang at their own game. Each video has a short, snappy length, and I fill it with accurate health information. It starts with an attention-grabbing hook or question, such as, why do you get diarrhea on your period? Or, will an abortion affect your fertility? Or even, why do you fart so much? I've learned that the power of true understanding of medical content comes from our ability to critically analyze information. So here are my top tips for how you can navigate the complex landscape of medical misinformation. Make sure you listen to the content carefully, in its entirety, because even as a clinician creator whose main aim is to provide accurate health information, I know that it's still possible for my content to be misinterpreted. Look at who's giving you the information. Is it a reputable medical institution or a qualified healthcare professional? Or is it someone with no medical background? And are they trying to sell you something? By embracing critical thinking and media literacy, we empower ourselves and others against misinformation. So, next time you're on social media, think about the way you're engaging with content. Don't fall for overly dramatic statements, and try not to take information at face value. Think about the credibility of the sources and information. Be wary of sensationalized statements, because they could be an attempt to manipulate your emotions. With responsible engagement and critical thinking, I believe that we can rebuild trust and ensure a future where reliable sources and informed decisions prevail. Thank you.